All right, guys, welcome into chapter 18. Today we're going to be talking about poisoning. So the first thing you need to understand is there's a difference between poisonous substances and toxins. So not all substances that are poisonous are actually toxic. So a poisonous substance is something that can cause harm in any way. Could be if it's used in the wrong way, or if it's used by the wrong person, or if it's used in the wrong amount. A toxin is a poisonous substance that is produced by bacteria, animals, or plants. Okay, so it's the toxin is the actual substance itself that is coming from bacteria, animals, or plants, so from natural substances. Whereas poisons can be anything, chemicals, synthesized or created things, created in a lab, things like that. So some examples of poisons. So speaking, I guess poisons are more broad. Okay, poisons in general, there are different types. So there's 4 types. Make sure you understand what these types are. It's going to be really important. So poisons can be ingested, inhaled, injected, or absorbed through contact. And the different forms they can be found in are solids, liquids, sprays, and gases. So some common poisons found in the home: antifreeze is poisonous, windshield washer products are poisonous, some medications or medicines can be poisonous, corrosive cleaners can be poisonous, fuels, pesticides. There's really a lot of things out there that can be poisonous if they're not used correctly. So the first type of poison that we're talking about is going to be ingested poisons, which is the most common type. So about 80% of all poisonings occur from being ingested. Okay, analgesics or pain relievers are the largest category of ingested poisons. They happen very often, usually through prescription drugs or drugs in general, or children getting into chemicals that they're not supposed to and drinking them and stuff like that. But don't confuse the frequency of the poisoning with the severity. So just because these ingested poisons happen the most often doesn't mean they're the most severe. In fact, they're not. Ingested poisons take longer to get into your system, and so most of the time they're reversible. They're definitely preventable, but most of the time they're reversible more than especially injected poisons would be. As far as some things to look for with ingested poisons, you're going to look for abdominal pain and cramping, nausea, vomiting, diarrhea, those systemic symptoms of the digestive system, burns, bad breath or stains in and around the mouth, drowsiness or unresponsiveness. If they're having difficulty breathing, speaking, or swallowing, can lead to a seizure, or you may look for the poison container nearby. Sometimes you kind of have to be a detective, especially with these young kids. You have to find out what's nearby and then kind of go from there. So the first thing you want to do, once you determine that you feel like somebody has been poisoned, you want to find out more about that person. Try and guess their age and weight if you don't know them. If you know them, then this will be a lot easier. How's the person doing? What are their symptoms? What are the signs that you're seeing? Looking for the nearby container to try and figure out what was swallowed, or if they can tell you how long ago it was taken and how much was taken is going to be really important. You're going to call the poison helpline, and they'll give you directions for how to treat that person. So that information from the previous slide is what you're going to tell them. Okay, I would suggest that you put this phone number in your phone. It is a national number, so it's not necessarily local. You can call this number, and they can send you somewhere that you need to go. They can give you advice on how to help them, those types of things. Okay, I had to do this a little while ago. My little daughter got into some powdered bleach called Comet. Most of you guys have probably seen it. Luckily, she didn't get very much. We actually didn't know. We couldn't tell, but they told us that unless she ate a very large amount, she was going to be fine. So we were okay. She was fine. But it was kind of scary. And so trying to figure out as much as you can about the situation. Try and look at the chemical level. Was it brand new? When they opened it, how low did it get? All those types of things. You kind of have to be a detective to be effective in treating poisoning situations. So this is a quiz question. Make sure you know this. If somebody has been poisoned, you're going to, or they've ingested poison, you're going to lay them on their left side. The reason is, if you'll remember from anatomy, okay, your stomach is sort of in between your left and right upper quadrants. And from your stomach, it goes to the small intestine. The entrance to the small intestine is on the right upper quadrant, okay? So in laying the person on their left side, we're using gravity to help prevent that substance from leaving the stomach and entering the small intestine, where most absorption occurs in the digestive system. Okay, and then from there, we place them on their left side. Then we're just going to monitor them, monitor their breathing. If they do stop breathing, we're going to begin CPR like we normally would. Okay. So now we're going to move on to the next type of poison, and that's an inhaled poison. So some things to look for. You're going to be looking for a headache, ringing in the ears, chest pain, muscle weakness, nausea and vomiting, dizziness or visual changes. This one's especially important. Difficulty breathing, speaking, or swallowing. Any sort of unresponsiveness. If they're having respiratory issues, that's going to be the most common issue with an inhaled poison. Cardiac arrest, or also looking especially for carbon monoxide poisoning. As far as what to do, once you determine this person has inhaled a poison of some sort, you're going to call 911 immediately. And then again, we're going to ask ourselves those same questions as before. What was it that they inhaled? When did it happen? How long ago? How long were they exposed to this inhalant? How long were they inhaling it? And what is the person's current condition? For this person, we're going to put them in a sitting or a reclined position, monitor their breathing, and if they start to, or if they stop breathing, we're going to begin CPR just like normal. Okay. Injected poisons. So things we're going to look for in this situation, we're going to look for needles. Okay. If somebody has injected themselves with something or something injected them, maybe it was accidental, we're going to try and look for the needle around there, for one, to protect ourselves, and then to try and figure out what the substance was. And then we're going to look for the injection site. Where did it get injected to? With injected poisons, like I mentioned, these tend to be the most severe because the symptoms are going to come on very quickly. The substance gets into the bloodstream almost immediately, whereas with swallowed poisons or ingested poisons, it has to go through the digestive system to get absorbed. These go directly into the bloodstream, so they tend to have a fairly immediate effect. As far as absorbed poisons, things to look for, they'll likely have a rash or a skin irritation because it will have contacted their skin directly. Systemic symptoms come on really slow. Our skin is a very thick barrier and does a good job of keeping bad things out of our body. But if somebody was exposed to a poisonous substance or a toxic substance for a long time, it will start to get absorbed through the skin. But it takes a while to start to cause those full body systemic symptoms. If somebody came in contact with a poison, there is also a chance that there are other types of poisonings that occurred. Ingestion, not very likely injection, but watching out for those other types is going to be, or inhaled poisons as well, right? If they're breathing in the fumes of whatever it is, that can also cause issues. So from here, now we're going to start to talk about some specific poisonings. The first is alcohol poisoning and alcohol emergencies. So alcohol, and we're going to talk about different type of drugs here in a little bit, but an alcohol is a depressant. It depresses or suppresses the central nervous system. So that's why alcohol affects judgment, vision, reaction time, coordination, these things that our central nervous system regulates. If not treated or if not monitored correctly, alcohol poisoning can cause death. As far as what to look for alcohol poisoning or alcohol intoxication, most of us have met somebody who's been intoxicated before, but when it gets severe, it can be quite different. First of all, they are likely going to smell like alcohol either on their clothing or on their breath. It can lead to nausea and vomiting. They're likely going to be unsteady, have bad balance. Their speech might be slurred. They may have a flushed face, but eventually, or they may struggle to have a regular conversation or talk to you. Eventually, it can lead to seizures. As far as what to do, look for injuries that the person may have. Alcohol can kind of mask pain, so if they have an injury, they may not know it. Monitor their breathing and treat them as you would somebody who is having breathing difficulties if they are. Put them on their left side. Again, this is an ingested poison, so we're going to try and slow down the intoxication process of the digestive system. Call Poison Center for advice, and then obviously call 911. Okay. If the person is violent, don't put yourself in a situation where you can also become severely injured and then create a second emergency. Okay. If they become real violent, it may be necessary to call 911 for their own good and involve the authorities to help take this person and get them taken care of. You may need to provide emotional support. If they are injured or unresponsive, you may need to assume that they have a spinal injury, depending on how they were injured. If you don't know, then yes, assume that at least to begin with, until it can be ruled out. Try and move the person to a warm place. If you determine that they do not have a spinal injury, you're going to want to move them to someplace warm. All right, so now we're going to talk about drugs a little bit and different types of classifications of drugs. So there are 4 types. You need to know what they are and an example of each of them, as this is going to be on the quiz. So uppers are stimulants. These are like amphetamines, like methamphetamine, cocaine. Caffeine is also a stimulant. Downers are depressants. These are barbiturates, benzodiazepines, narcotics. Alcohol falls in this category. Hallucinogens like LSD, peyote, marijuana. Marijuana also sort of falls into the depressant category. And then you have inhalants, which are like paint, gasoline, nail polish remover. Make sure you know those. Sympathomimetics are a type of stimulant. A stimulant is any sort of agent that's going to create an excited state. It's going to increase the heart rate. It's going to give the person energy. Can create sort of a manic state. Basically an overexcitement. And they won't be able to stay still, those types of things. So cocaine. Cocaine can be taken several different ways. It can be injected. It can be inhaled. It can be ingested. It is one of the most addictive substances known to man, and it can induce strokes, seizures, and heart attacks. So that cocaine is very, very dangerous. Signs of cocaine abuse are disorganized behavior, hyperactivity, restlessness, anxiety or fear, paranoia or delusions. And it doesn't just have to be cocaine. A lot of these symptoms can go for different types of stimulants. Next, hallucinogens. They typically produce mood changes and sensory awareness. It might make people who use them dangerous to themselves or to others. They may be seeing things or hearing things, and that can cause them to react in dangerous ways. With hallucinogen use, the person will often report like a visual hallucinations, an intense hearing or vision. I've heard the phrase before, people who use like marijuana or stuff like that, like, oh, I can hear the color blue. Things like that that are just not natural. Acute intoxication of a hallucinogen requires medical attention. Users really should be protected from hurting themselves. The classic one historically has been LSD. PCP causes really severe behavioral changes. Just some things to be aware of. Specifically about marijuana within the hallucinogen category, it's very common. It's estimated that up to 20 million people use it daily in the U.S. Some signs and symptoms of marijuana use: euphoria, relaxation, drowsiness, short-term memory loss, impaired thinking, depression, confusion, altered perception of time, anxiety or panic, hallucinations. So my perspective on marijuana, in Utah, if you have a medical card, you can use it legally. Recreationally, it's still illegal. The thing is, I actually attended a discussion last year about the use of cannabis and CBD and THC and those sorts of things. And the biggest thing that I took away from that is the lack of uniform opinion between government agencies like the FDA and medical agencies on appropriate dosages of CBD and these types of things. So the biggest thing is there's a lot that we don't know. If you choose to participate in these things, just be aware that recreationally in Utah it is illegal and you can be subject to the law. But also be aware that these symptoms can get really severe and can cause problems, right? Can lead to difficulty in your life, can lead to issues. Okay, that's all I'm gonna say. If you choose to use it, good for you. I hope you use it safely. That's all. Abused inhalants, the last category we're going to talk about. People will inhale glue or other solvents. They produce similar effects to using alcohol. People who inhale these substances can die of suffocation. They can change the rhythm of the heartbeat, and they can lead to permanent brain damage if they're abused. Some things to look for somebody who might be abusing them: mild drowsiness and even unresponsiveness, slurred speech and clumsiness, can lead to seizures or a very, very slow breathing rate, also called bradycardia. They may smell of the solvent as well. Okay. The last one is depressants. Excuse me, I kind of got ahead of myself. So the thing about depressants, this is probably the most robust category we're going to talk about. They're very easy to obtain. Okay, you can get prescriptions from physicians, and some people will abuse that system. Things like sedatives or opiates are the most common types of prescribed depressants. But that's why they're most often abused, is because they're easy to get a hold of. So opiates. Opiates are a classification of drugs that relieve pain. They trigger the release of specific endorphins, which are natural chemicals that boost happiness. And because of that, they're highly addictive. In recent years, as many of you probably know, the fatalities associated with opioid abuse and overuse has been really bad. And so they've been really focusing on helping educate people about that to not abuse them. Most opioids are narcotic pain relievers, like morphine, heroin, methadone, fentanyl, oxycodone, are just a few examples. but there are others. Overdose can happen when a person doesn't understand the directions. They take it more than they're supposed to, or they take the wrong amount. Unintentionally taking an extra dose, they forget they took the first one. Some will deliberately misuse the prescription or an illicit drug. Sometimes people will take a medication that's prescribed for someone else, and it can cause them harm. Or they mix opioids with other substances like alcohol or over-the-counter drugs. So any of those can lead to what's called overdose. An overdose is just an over-depressant, like an over-depression of the central nervous system. It causes the body to basically shut down. So some things to look for: extreme sleepiness or drowsiness, unresponsiveness, breathing problems, lips and nails that are turning blue, so poor blood flow, poor circulation. That also leads to skin feeling cold and clammy and extremely small pupils. Essentially, the body's systems that the brain regulates, like breathing, consciousness, like thinking, begin to slow down significantly. Heart rate, all of those things. As far as what to do, again, we're going to check those beginning emergent things. If they're not breathing and you have a second person with you, have that second person call 911 and get an AED and naloxone and begin CPR. If they're not breathing and you're alone, do 5 cycles of CPR before calling 911. Get an AED and naloxone. Now, this is kind of an exception because of the nature of the emergency, because it's not necessarily a rhythm or a heart defect that is causing the problem. It is a drug that's suppressing the central immune system. And sometimes doing CPR can help lessen the effect of that opiate or opioid and can kind of bring the person back into consciousness and bring them back. So that's why they want you to do those 5 cycles of CPR first. So now we're going to talk a little bit about naloxone. I did post a link on Canvas of how to a website to Utah Naloxone. It's an organization that's put together to help create awareness, to help prevent some of these emergencies. And so, yeah. There's a lot of good videos on this website for how to use naloxone. I don't have a video on how to use it. I know how, but I don't have a video to share with you guys, so that's why I'm posting this link here. Go ahead and visit there, watch the videos for how to give it. It's a lot like an EpiPen that we talked about earlier in the semester, but they work really good. What it is used for, naloxone is a medication that's used to reverse the effects of an overdose. Restore breathing, restore a normal heart rate, those types of things. Okay. So just a quick overview of how to use it. By the way, make sure you know what naloxone is. It is a question on the quiz. Don't delay giving CPR while waiting for the naloxone to work. So once you use the naloxone, once you inject it, go right into CPR. Don't wait. There are 2 different types. It's either an injection, like I mentioned, kind of like an EpiPen, or you can get it in a nasal spray. The nasal spray is harder to get a hold of for your normal first aid provider or your normal person. Typically, it's healthcare providers that have those, EMS, those types of things. But us as normal people, you can. They do. Some organizations will offer free kits, free injectors. Some pharmacies will give it out for free. If you are worried about somebody in your life that may be misusing drugs, those types of things, that may be something you may want to think about. If it is given and the person becomes responsive and is breathing, continue to monitor breathing and do CPR if it stops again, just while you're waiting for EMS. If naloxone is not available, stay with the person until EMS arrives if they're still responsive or if they're still breathing. If you can try to identify the drug that they partook of, that can be really helpful as well for healthcare providers to try and nail down what symptoms they need to try and reverse. So now we're going to talk about carbon monoxide. Some of you guys have probably heard it. Carbon monoxide is produced from the incomplete combustion of carbon-based fuels, things like wood, things like coal. So yeah, we'll talk about some more examples on the next slide. But something that's really important about carbon monoxide is it's odorless, colorless, and it's really non-irritating. So it's not like it makes you feel it'll make the person feel off and feel different, but it's not like it really upsets the person. And by non-irritating, it's not like it causes pain. It's not like it burns your eyes or things like that. It goes relatively unnoticed. Okay, and we'll talk a little bit more about that in just a second. So some common sources of carbon monoxide: cars, cigarettes, faulty furnaces, water heaters, portable generators, open flame fires, and charcoal grills. You should never operate these things in an enclosed space without proper ventilation. So you do have to be really careful. That's why you never run your car in a closed garage. That's why you always have the chimney open and the damper open when you're running a wood-burning stove. That's why you don't grill inside. That's why you shouldn't smoke inside, those types of things. So as far as signs and symptoms to watch out for carbon monoxide poisoning, watch for things like dull headache, ringing in your ears, chest pain, muscle weakness, nausea or vomiting, dizziness, loss of responsiveness, eventually respiratory and cardiac arrest, and cherry red skin and lips. Now, the deal with carbon monoxide is, if you'll notice, a lot of these symptoms are for a lot of different things as well. So that's why a lot of times carbon monoxide goes unnoticed, and why it's ultimately fatal, because people don't know that they're getting carbon monoxide poisoning. And so that's why you have to be so careful. Now, what carbon monoxide actually does is carbon monoxide in your bloodstream, once you breathe it in, it will actually take the place of oxygen on your red blood cells, and so your red blood cells will no longer be able to transport oxygen to the body. So you essentially suffocate. Okay? So if any of these things start to come up, well, we're going to talk about this on the next slide, but there's some things you should do. So besides just the symptoms themselves, some other things to look for that may point to carbon monoxide is that the symptoms come and go. So the symptoms are only going to show up when you're near the place that the carbon monoxide is coming from. So if it's coming from your furnace, you're only going to feel it when you're in the house. When you get out of the house, you're not going to feel it anymore. Your symptoms are going to go away. Same would go for, like, it only happens when you burn a fire in your wood-burning stove. Or it only happens when you go to this person's house. Those types of things, it may only worsen, or it may only show up when your furnace kicks on, right? Like, furnaces don't always run 24/7 in the winter, and so when it's not running, it goes away, and when it starts running, you start to feel it again. Other people, when they come to your house that don't live at your house, start to have similar symptoms. Your pets will also feel the symptoms of it. So those are some different things to look for to maybe point to carbon monoxide poisoning. As far as what to do, just get out of the environment. Get away from the source. Call 911. If the person becomes unconscious, monitor their breathing. Give them CPR if they stop breathing. Any unresponsive breathing person should just be placed in the recovery position like we mentioned before, and of course get medical care as soon as possible. The biggest thing is just getting away from the source of the carbon monoxide. So the last couple things we're going to talk about are absorbed poisons and some specific instances, especially plant-induced dermatitis. About 85% of the human population is sensitive to poison ivy, poison oak, and poison sumac. So the resin of these plants is colorless or slightly yellow. It looks oily, but it only causes problems when it is met by direct contact. It can stay active for months or years, so even if it gets on your clothes while you were hiking, if those clothes don't get washed, or if your backpack doesn't get washed, it can still be on there even if you touch it later. So poison ivy and poison oak they're low bushes with vines that will climb up other plants. They have broad leaves that are waxy and green in the summer. Their leaves go a brown to red color in the fall, and their leaflets grow in groups of 3, as you can see from the pictures here. Poison sumac is found in damp and swampy areas. Okay, so all 3 of these plants, you can identify them by the black spot test. And that is if you grab a leaf with gloves on, of course, and you squeeze the sap onto a white piece of paper, it will turn the piece of paper black. That's how you can test for these. So if it's in your yard and it's a plant you're not sure about, you can do it that way. As far as what to do, within an hour of exposure, try to gently wipe the skin with rubbing alcohol to clean it off. Wash it off with soap and water and rinse it with cold water. Don't use gasoline to get it off. Doesn't work. For mild itching, you can use a few different things. Use an oatmeal bath, baking soda paste, calamine lotion, aluminum acetate solution, urushiol solvent product, a physician prescribed medication, and over-the-counter hydrocortisone. For a moderate reaction, you're really going to treat it about the same as a mild reaction, but you may need to go to a physician if it starts to get worse or the itching gets really bad. They may have a steroid ointment that they can prescribe you. If it's really severe, causing blisters, those types of things, again, you're really going to treat it about the same as you would a mild or a moderate. But again, you may go to a doctor and they may give you an oral steroid or a steroid cream to help take care of it. Another type of poisonous plant, stinging nettle. We do have stinging nettle around here. It has leaves with little hairs on it that it's kind of like a cactus. The needle point hairs will penetrate the skin and inject an irritating chemical. Typically, the effects are really only limited to the area of your body that touches it. The response is usually pretty quick. It hurts right away. It's not like a slow process. It can produce a little bit of redness, burning, and itching. As far as what to do, wash it out with soap and water. You can apply a wet cold pack. Use calamine lotion. Take an over-the-counter antihistamine. Put like hydrocortisone on there, stuff like that. Take Benadryl. Some of those can help. But yeah. So that's the chapter for poisoning. If you have any questions, please reach out. Be happy to help. See you later.